I'm Dr. Jared Bonaquisti from Kinetic Physical Therapy, and today I'm just going to be doing a short presentation on rotator cuff injuries, specifically tendonitis. So the first thing that we have to look at here is the anatomy of the rotator cuff, which is made up of four muscles. The first one that we're going to talk about here is the subscapularis, which is this big, thick muscle on the underside of the scapula, and it assists with internal rotation of the shoulder and also with the stability of the shoulder. The other three muscles are on the back side, or the posterior aspect of the shoulder, and they are the supraspinatus here. Then you have your infraspinatus, which is right underneath the spine of the scapula, and then your teres minor muscle. So those all assist with external rotation, or they're the primary movers for external rotation, and they assist with glenohumeral stability. The next thing we're going to talk about here is the bony anatomy of the shoulder. The first joint that we're going to look at is the glenohumeral joint, which is a connection between the humerus, right, and the glenoid fossa of the scapula. You have the acromioclavicular joint, or the AC joint, which is comprised of the acromion, some connective tissue, and then the clavicle here. And if we remember from the previous picture, your supraspinatus muscle, right, connects onto that medial border here and then runs between these two bones, right, your clavicle, the spine of your scapula, and runs underneath the acromion to the greater tuberosity, which is right out here. And then underneath is where you have your infraspinatus and your teres minor, which both connect. One connects to the medial border, one to this inferior angle here, and as they run up again to that greater and lesser tuberosity. We need to make sure that we know the bony anatomy here because it will play a factor in rotator cuff tendonitis. So what is the rotator cuff and what is its purpose? So like we talked about before, the rotator cuff is comprised of four muscles, right? The supraspinatus, infraspinatus, teres minor, and subscapularis. And the purpose is that it assists with internal and external rotation. It assists with abduction or raising the arm out to the side, and then creates stability during static and dynamic movements of the arm, whether that be an open kinetic chain or closed kinetic chain movement. An example of open kinetic chain would be taking a plate, right, off of a shelf or lifting it up. That aspect of holding a weight out in front of you, right, and your rotator cuff needs to create that stability of your shoulder for you to be able to complete that movement, whatever it may be. And then a closed kinetic chain is when your hands are on the ground or something that is not able to move, and the movement is going to occur with your body. Think of doing a push-up on the ground. That is a closed kinetic chain movement. And then the last thing that the rotator cuff does, right, the big purpose, is that it seats the humeral head within the glenoid fossa at rest, and again with activity. So that's that part of that stability there. So if you're raising your arm up overhead, those rotator cuff muscles are going to activate and fire in a specific way to make sure that you don't have any impingement, that you don't have any tendon irritation, and then that glenoid fossa, right, and the humeral head is going to actually be very congruent, and you're going to have nice, easy motion all the way up and then all the way back down. So the common presentation of rotator cuff tendonitis, if we're looking at some of the symptoms, you're going to have pain in the front or lateral aspect of the arm. It's usually described as something sharp or stabbing. Specific movements, like active movements, can cause the pain to occur. A clicking sound or a feeling of a clicking can occur, but it's not always present with this sort of pain. Stiffness with movement, especially in the morning after sleeping, difficulty sleeping on the right side or on whatever shoulder has the irritation, right? Sleeping on that side will be difficult. Pain with reaching behind your back because you're putting those tendons in a stretched position, and that can cause a lot of pain. And then decreased strength, whether that be due to pain or because of the rotator cuff and the weakness that or the pain or the weakness that you're having, just decreased strength in general. To diagnose this, we're going to use a person's past medical history. What have they done recently? What are some of the signs? When did it start? A physical examination, which also is going to look at thoracic mobility, the thoracic spine just in general. What do the rest of the musculature of the shoulder girdle, what does that look like? And then we're going to use special tests to try to figure out which tendon it is specifically. Now, new research is coming out that's showing that special tests aren't as specific as we would like them to be. So the idea that we can do what's called a Hawkins-Kennedy test, and if that is positive, say it's definitely supraspinatus, is not always the case, but they can still be used to help come to that diagnosis, or at least narrow it down to a few possible diagnoses there. So what causes rotator cuff tendonitis? A big thing that you'll hear from your doctor when you go to see them for the first time, or when you go to see a physical therapist for the first time using direct access, is you're going to see, or you may hear, of shoulder impingement. And that just means that somewhere along the line here of these muscles, you're going to have that tendon be irritated to the point where it's being impinged, right? If it goes through a normal motion, it's not able to get there, or it's being irritated by something. So that's kind of the catch-all term that we use here. Some of the things that you may see, right, or what causes it, is excessive stress placed on the tendon due to decreased strength in specific muscle groups. So if we look down here at this picture, right, this is what's called a force coupling. So all of these muscles, right, your deltoid muscle, your upper trap, your middle trap, your lower trap, and this serratus anterior, which is on the side, right, or the side flank or the lateral aspect of your body, needs to fire in unison here with the appropriate activation to cause upward rotation of the scapula and to allow you to be able to reach up overhead. The problem can be that if one of these muscles, and that kind of goes down to this point there too, right, decreased functional movement, if you don't have the proper activation, like let's say your serratus anterior and your lower trap are very weak, the idea is that your deltoid, upper trap, and middle trap are going to actually fire more, cause your whole shoulder girdle to slide up, and then that is going to irritate some of these tendons here, because now instead of being in a proper functional position where they can work at their greatest capacity, there's either going to be less space, which will cause irritation, or they're going to not be in the appropriate position. Those muscles are going to be overworked, right, or the excessive stress on those tendons, and then you'll see breakdown, you'll see the pain start, and that's where those little micro tears, that tendonitis starts to form. Weakness of the rotator cuff. This goes back into that overuse type of injury. If your body is not ready for a specific exercise or movement, and you try to put it through that movement, a lot of times we'll see people who are the weekend warriors who all of a sudden go out and throw, 50 balls, with some buddies that they haven't done in a couple years maybe, and all of a sudden this posterior shoulder, you start to see some of that breakdown because of that stress that's being placed when you're trying to slow your arm down. So that's where those tendons can start to get irritated, okay, as they kind of travel underneath or just due to your everyday life. So prognosis and treatment. The prognosis is usually very, very good for just tendonitis itself. One study found that 8 to 12 weeks, right, would be the prognosis, or would be the time frame, for uncomplicated shoulder impingement syndrome or rotator cuff tendonitis. And then in that same study, they found that, 12 to 24 weeks for more significant injuries. So you're talking about, instead of your more acute type of injuries, you're talking about your subacute and your chronic conditions that have not been addressed, or recurring tendonitis, right, that turns into something a little bit more serious there. Treatment-wise, right, focusing on physical therapy, because that's still, if you have rotator cuff tendonitis, this is going to be the best case for you, going to physical therapy to get that treated. Again, the time frame, it's going to take a long time, but it's better than any sort of other passive modalities, and we'll address that in a minute here. So in a study published in March of 2020, right, evidence for exercise as the most important management strategy for subacromial shoulder pain is increasing and strengthening, meaning that the more studies that they do on the effects of rotator cuff tendonitis or subacromial shoulder pain, right, the more studies they do, we're focusing on exercise, the more evidence comes out in favor of exercise. Manual therapy was also provided, right, as a strong recommendation as an adjunct intervention with exercise. So in a physical therapy treatment, you'll usually get manual therapy to help with capsular dysfunction or to help with improving joint mobility, and then couple that with your exercise. That is the best and the strongest recommendation for subacromial shoulder pain, which includes rotator cuff tendonitis. In the same study, they looked at passive modalities like ultrasound, laser therapy, shock wave, moist heat packs, and it just lacked evidence of any effectiveness at all. So exercise-wise, these are just some of the exercises that you may get from your physical therapist when you're in the clinic. The first one here is to improve thoracic mobility. Like we talked about earlier, having a lack of thoracic mobility actually puts your shoulder blade in a bad position to be able to rotate, right, or upwardly rotate when you're reaching up overhead. So improving thoracic mobility will be key. Working on your scapular retractors, you're being able to pinch your shoulder blades. Again, working on that force coupling to allow for good upward rotation and proper synergy of those muscles, right, to decrease any stress on the tendons. Working on the rotator cuff muscles themselves, stressing the actual tendon that's injured. Right here we're working on external rotation, so the back of the shoulder there, those three muscles on the back, stressing those tendons there without putting them through a lot of movement, especially if movement is the main cause of pain. We want to stress the tendons so that they can start to heal without moving through any range of motion and causing more pain. And then right here we have what's called a no money exercise, and that is just a combination of working those shoulders, right, the posterior shoulder, and also those scapular retractors. If you need help or you're having any pain right in your shoulders, please don't hesitate to reach out to any physical therapist if you've gone to one before. But we would love to help you out there as well. So you can contact Kinetic at any of the listed through Facebook or Instagram. The main office number is right here, and then my email is at the very bottom here in case you have any questions about anything at all. Feel free to reach out at any time. Thank you. I hope this was educational for anybody. And again, if you have any questions or you're just looking for info, please feel free to reach out. Thanks.